So welcome everyone to the Emerging Models of Medicine Practice session here at Pri-Med Southwest. My name is Evan Pankey and I am the product manager for Enlight EHR. This panel is about doctors who have taken a step out of traditional practice and exploring new ways to engage their patients in quality health care. So what we'll have for the next 45 minutes is questions and answers from myself to the panelists, and then we'll open it up to questions from you all, our audience. So first, I'd like to introduce our panelists and tell you a little bit about them. So first, we have Dr. Sunil Mova, who is the owner of Integrated Healthcare here in Houston, Texas. He's been practicing in direct primary care for the last 2 years. Next, we have Dr. Corey Annis, who heads Unorthodox in North Carolina. And she has had experience in traditional fee-for-service, concierge medicine, and is now embarking on her direct primary care journey. Next, we have Dr. Kelley Pendleton, who is a chiropractor by training, but has recently transitioned into a focus on helping practices with marketing when they decide to embark on their own journeys of emerging styles of practice. And she has a book called Community Connections. It's recently been published, and a new book coming out soon. And finally, we have Dr. Gitu Goyal, who is a pulmonary and critical care physician here in Houston. He finished his residency training at Yale and has been working here in Houston independently, working in hospital systems and various other practice settings. And he has an interest in technology and providing consultative services to physicians interested in emerging models of care. So with that, let's welcome our panelists. So I'm just going to start with some questions. The first question that many of you are wondering probably is, what exactly is direct primary care? So Dr. Kelley, maybe you can tell us a little bit about your perspective, especially coming from practice as a chiropractor and looking at these emerging models.
Sure. So as a chiropractor, most of the people in my profession kind of start out doing it's very similar to a DPC model. Chiropractors weren't accepted on insurance plans until roughly the 1980s, which was before my time, but we still had to kind of learn the system and learn how to work with cash-paying patients. So in that regard, it's very similar to the struggles that somebody transitioning to DPC might face. And the way that I look at DPC is it's just going back to medicine the way my great-grandfather practiced it. It's a relationship between the provider and the patient, and they work out the details in whatever way suits them and gives them that freedom and flexibility and provides optimal care. So I think it's a beautiful thing, and I think it's the way of the future.
So as you all know, healthcare is really about patients. And with this different style of practice, one of the challenging aspects is explaining to patients what this model is and what the benefit is to them. So next question to the panelists is, if you could tell us a little bit about how you've engaged your patients in understanding this model.
I think we've all encountered a time where we've had to explain something to a patient that was completely foreign to them. And this is no different, whether it was a condition that they had or a family member had, or it's the new way your practice is going to do business. You're still explaining a new concept to them. So breaking it down, keeping it simple. And Dr. Annis, I totally agree, focusing on the fact that you're removing all the middle people and you just want to focus directly on your relationship with that patient, cultivate that doctor-patient relationship and bring it back to what it used to be. And if that's coming from the heart and it's genuine, they'll get it. And if they need some help, you can always have the discussion with them that insurance companies are publicly traded, which means what is their interest? To make a profit, just like any business. They don't care about the health of the patient like the doctor does. So that sometimes helps tip them over the side too.
My next set of questions to the panelists, and we can start with Dr. Kelley, is kind of what advice do you have as far as marketing yourself as a practice and building up panels?
So my first piece of advice is start yesterday. Don't wait. So many times, doctors that I work with, they wait for more time, more money, more staff, the right season, the right event. But really, this is about getting back to that relationship with your patients, and the way to have a relationship is to spend time and to cultivate that relationship. So having a written marketing plan that's easy to follow, and I promise they're not hard to set up. That can be done pretty simply, and then sticking to that marketing plan and getting out there and being involved in your community. But don't wait. That's oftentimes the biggest hurdle, is that people put it off because they don't want to. It's distasteful, they think, to market. But I say, just don't think of it as marketing. Think of it as sharing what you have and the gift that you have to share, and helping people understand who you are and what you have to offer. Because then when they need your services, they will think of you. And it's just a natural relationship and a natural fit. And when you do that and it comes from the heart, people will be beating a path to your door. And it's replicable. It happens over and over and over. So find what it is that makes you passionate. Find the types of activities you like to do. Maybe you're a runner and you want to help more runners in your practice. Sponsor a 5K. Right? That's not traditional marketing, but how great is that? Get a great warm and fuzzy feeling out in the community. You get people up and moving. You promote health, and you get your name out there. So things like that, thinking outside of the box in terms of just traditional, let me take out a yellow page ad, and use technology, because I guarantee you, if you're not using technology to market, and it doesn't, again, have to be scary, but if you're not doing it, your competitors are. I promise you that. So those are my two big things. Get started, or three big things. Get started, have a marketing calendar, and use technology where it's appropriate.
How did you educate yourself about this model, and where are the resources that you would recommend for someone who's just curious or embarking upon this journey?
I pretty much used a lot of the internet and direct sources. Like I went directly to the Q Alliance website and just scoured the information there. And there are direct primary journal, I think, was another one that was really big on the radar. But I really agree, just keeping that dialogue, keep talking to each other, talk to the people that are already doing it, talk to your patients about it, keep the dialogue open and the conversation going. And I think that will bring up a lot of questions, but answer a lot of questions as well.